Clinical Genetics at Miami Cancer Institute. Every cell in the human body contains around 23,000 genes. Genes are made of DNA, which gives the cells in our body the instructions they need to make copies of themselves, to create our human bodies, and allow us to grow and stay healthy as we age. Each parent contributes half of the genes in their children. Because we share our mother and father's genes, we inherit certain characteristics from them. The study of heredity and its variation is called genetics. Advances in genetics, including the mapping of the human genome, have had a profound impact on the study and treatment of cancer. Certain genes help protect the body from developing cancer. When your cancer protective genes don't work properly, you may be predisposed to developing cancer. Genetic risk assessment is a comprehensive evaluation of your medical and family history. It includes sophisticated genetic testing to study your cancer protective genes. This information can help you and your family members be better equipped to consider your cancer prevention and treatment options. When your physician refers you for genetic cancer risk assessment at Miami Cancer Institute, or you self-refer, you'll speak with a scheduler to set up your first appointment. You will also complete an online questionnaire about your medical and family history. Providing this information ahead of time will help focus your consultation on counseling you and answering your questions. On the day of your first visit, you'll come to Miami Cancer Institute's Clinical Genetics. You will meet with a genetics professional, such as a board-certified genetic counselor, who will collect and review your family and medical history, educate you about genetic risk for cancer, and work with you to develop a genetic testing strategy. If genetic testing is indicated, your visit will include coordinating a blood or saliva sample collection for genetic testing. If you have reports from any previous genetic tests, you should bring those with you. The genetic testing laboratory will work with your insurance company for genetic testing coverage and will review with you any costs associated with your tests. Most insurance companies cover genetic testing. Self-pay genetic testing options have also become more affordable over time, and financial assistance is available to offset potential costs. Genetic tests can take several weeks to process. Breast cancer panels needed for surgery are generally ready in about 2 weeks. More extensive genetic testing panels may take 4 to 6 weeks. Once your genetic test results are available, you will meet again with a genetics professional, such as a clinical geneticist. This is a board-certified physician who is specially trained in evaluating, diagnosing, managing, and treating inherited conditions in patients of all ages. The physician who referred you for genetic risk assessment will also receive a copy of your genetic test results. Your test will have one of 3 results. A positive test result means that a non-working cancer protective gene has been found. If you have already had a cancer diagnosis and test positive for a non-working cancer protective gene, your medical team will use this information to develop a recommendation for your cancer treatments or surgery. If you don't have cancer now, but are determined to be at increased risk, your physician may recommend a modified screening schedule or other options, such as prophylactic surgery. This is a surgery that attempts to prevent the development of cancer in an organ known to be at increased risk, such as the breasts, ovaries, or uterus. Negative test result means that no mutations were found, and all of your cancer protective genes are working normally. Even with negative results, your medical team may still recommend modified screening or intervention strategies based on your family history. An inconclusive test result means that a genetic change was found in one of your genes, but there is not enough information to determine its significance. These results do not impact your medical care. Most inconclusive results are reinterpreted as negative over time. If your genetic test identifies a mutation in a cancer protective gene, there is a 50% chance that your first-degree relatives, meaning children, siblings, or parents, also have that same mutation. In this case, your physician will recommend that your at-risk relatives also pursue genetic testing. Learning that you and your family members carry a mutation in a cancer protective gene gives you the power to stay vigilant about your health and take action if needed in the future. If you have a family history of cancer but test negative, your physician may still recommend frequent screenings. Other family members may still benefit from pursuing their own genetic testing as well as additional screenings based on family history. Genetic cancer risk assessment at Miami Cancer Institute can empower you and your family members with valuable information for reducing and managing your cancer risk. There's much more to learn about Miami Cancer Institute. Visit us online or contact the Institute to schedule a personal tour.